I charge $300 for 30 minutes now. But with my experience, I'm usually able to get a lot of groundwork laid there. And most people that come to see me just want some additional information on how to use their own devices. So it ends up kind of turning into a miniature training as well. Hello, everyone, and welcome to our TSI 10-minute training for the week. Today, we're going to be talking about a topic that I see come up a fair bit, and hopefully I can shed some insight onto this for people. And that is what to price your therapies at. So really looking at what to charge, why, and kind of how. And I think it all comes down to whereabouts you are in your, essentially your practice journey. If you are in a place where you are brand new to this versus the more experience you have and the harder it is to fit clients in, you can adjust your price base as you go. So let's start from a basic level. I think at a minimum, what I look at is if you look at the cost of around what it costs you to go to a massage therapist or a chiropractor or something in the area. Now, for me here, a chiropractor is $60 for 15 minutes. So that works out to be what, $240 an hour. And a massage is about $130 an hour at this point in time. So when I was starting out treating, I started with $125 an hour. And then this kind of changed because an hour is a long time for a microcurrent therapy session, and it kind of became adapted into different breakdowns of types, right? So what type of treatment are you doing? For an initial visit, $125 for an hour made sense because you're going to spend the first 35 minutes or so going through their case notes, asking them questions, figuring some things out. And then you're going to do some basic protocols. After that, what I started to do was charge about $100 for half an hour to 45 minutes and do specific treatments that were longer, like 3 pathways. If I was going to do a 3 pathways and 6 points, this would be $150 because I would book a full hour for that just to make sure I can do elimination assistance, 6 points, all of the things that are required as well. Now, beyond this, one of the things that became most desired by people as more and more of my patients and our family's clinics patients got their own devices was Mead readings. People wanted to come in and get an analysis of their meridians so they knew what to do with their at-home device treatment. Now, a Mead reading takes anywhere from 3 to 5 minutes to do. And essentially, you're then giving them a report. And what I would do is I would explain the report in that process. And I charge $75 for a 15-minute Mead reading. This kind of became the foundation of what people mostly needed and wanted, unless they needed complex protocols like 3 pathways, 6 points, abdominal, or something like that. When I was dealing with the complex regional pain syndrome patients, CRPS patients, I would definitely spend longer on them. And so you kind of have to come up with really breaking down what you're comfortable charging for a 15-minute session and then increase that based on what is needed. I've seen a lot of talk about people saying, well, how much do you charge if you want to add Scalar? And how much do you want to charge for this or that or the other? And I've never really added those on as extras. But I do know of some people that do. And I've seen, as simple as like $25 for a Scalar session as well at the same time. And you can definitely do that to enhance the therapy, or you can just do it in general and not charge them extra for it. But you can see you can kind of start to add these things up. Another thing that you should be charging as well is for consumables. If you're using conductive pads on a patient, charge them the retail price of the conductive pads on their first session, write their name on the pack, and keep reusing them for that patient. It's medically safer that way to be using the individual attachments for patients, and it's a one-time charge. Same goes for tongue stimulators. If you are doing tongue stimulator work, you can buy them in bulk, sell them to the patient at retail as the first charge, and then it is their tongue stimulator in perpetuity, right? You keep it in a bag, so you can keep reusing it for them, but not for someone else. Obviously, you still want to clean it between sessions. So those are some additional extras too. Beyond this, it kind of becomes very challenging to price things out because it is regionally dependent, right? So what are you going to be able to charge in any given situation and why? And so it will come down to your individual comfort level. What I can tell you is that I have increased my rate over the years. You have to make it worth your time and what you're doing in other ways, shapes, or forms. I charge $300 for 30 minutes now. But with my experience, I'm usually able to get a lot of groundwork laid there. And most people that come to see me just want some additional information on how to use their own devices. So it ends up kind of turning into a miniature training as well, because many of the practitioners in our town here now, even medical doctors, have our microcurrent devices, and they only really lean on us when they are in need. So very rarely do we get patients that are simple. Usually it's very complex things like 3 pathways and so on. And you have to be able to make the time worth your time for what you're putting in. So different rates are going to change and go up over time. But I think that kind of gives you a little bit of an idea. I know that the average that people charge is about $100 to $120 per hour. I just do believe that an hour can be a very long session unless you're combining it with other therapies, which I absolutely encourage. So it's really going to be about what it is that you are comfortable charging. But hopefully this gave you some insights into the pricing structures and giving you something to think on what you should charge for certain additional treatments and therapies and where that baseline value is found. If you have any questions at all about any of these prices or any ideas of different things like what should I charge for PEMF or for this or that or the other, go ahead and post them below. I will make sure to respond. And if you are a practitioner already practicing with microcurrent, I'd be interested to know what you charge at this time. And if you have it tiered for different things, if it's just 15-minute sessions, 30-minute, an hour, and what you do in those sessions. So please go ahead and share with us so we can get more information out there to everyone else to see the variety of different things people charge for different things, and they can start to build a pricing structure of their own. So awesome. Thank you guys for joining me today. Again, any questions, let us know below. Take care. Bye-bye.